Welcome to Silver Solutions Radio, an enlightening and engaging program discussing various topics preparing you and your family for the golden years. Questions, answers, and solutions about taking care of loved ones and helping them to remain independent and enjoy an active and fulfilling life. And now, right at home, in-home care and assistance and WRMN AM 1410 present Silver Solutions Radio.
Good morning, everyone. Welcome to Silver Solutions Radio. This is your show for living long and aging strong. As always, we're bringing this show to you because we're passionate about helping people, especially in our senior and disabled communities. I'm Jim Wojciechowski, your host today, and I'm joined here by my co-hosts, Kathy Wetters and Jeanette Palmer.
You're listening to WRMN Radio, AM 1410 and FM 96.7 on your radio dial. This is your show, and we're going to encourage you to call in with any questions, comments, anytime during the show. The number is 847-931-1410, 847-931-1410.
Our show is brought to you again today by Right at Home. The 4 pillars of right care from Right at Home mean your loved one is cared for the right people, by the right people, doing the right things the right way for the right reasons. Give us a call today, 877-ELDER-99, 877-353-3799.
We're excited. Live radio. I love it. We're excited to have back in our studio a wonderful person. We're very excited to have her today, who cares so deeply and so passionately about our seniors. Jean Lamas is the founder of Care Navigators and has expanded her help to our seniors and their families with a company called Care Guardians. Jean, welcome back.
Hi, thank you for having me.
It's great to have you on the show today. Let's start by sharing a little bit about yourself, and then we'll get into all the things that Care Navigator and Care Guardians has to offer our senior community and their families.
Okay, so I have been a nurse for over 20 years. I'm master's prepared and have a bunch of fun letters after my name. I'm certified in case management and guardianship, a board certified patient advocate, and dementia also. So basically, nursing has been a great career for me. I've been able to help people throughout all different types of capacities, and it has brought me here to healthcare advocacy and care management, using all my background to do what's right for patients in a very fragmented healthcare system, which we were talking about earlier.
Now, we just had Jean at one of our events called Caring for the Caregiver. And I haven't heard Jean speak before, but her passion and her advocacy for the people, for her clients, boy, I wish everybody had somebody like you on their side.
Oh, thank you.
Can you give us an overview of what Care Navigators and Care Guardians does?
Sure. So we are a missing set of healthcare entities that actually complements like your company, Right at Home for caregiving. So we provide counseling services with our social workers. That's brand new for us. We also do bill pay, something that most companies aren't allowed to do. We actually act as guardian under Care Guardians, actually power of attorney for healthcare for property, and we don't go into effect, or we're not enacted as a power of attorney unless the person loses capacity, of course. We also do healthcare advocacy at hospitals and rehabs to get people the right care, and actually coordinate a lot with all the different healthcare providers. And one of the fun things is we get to save people a lot of money by bringing in different resources and community resources for people.
And so I've got to add that I know we're supposed to ask questions, but I've got to add that Care Navigators has saved a lot of clients so much anger and frustration from medical mistakes. So we had one instance where Care Navigators was there and the client was getting discharged from the hospital and they didn't have the pain medication to take home with them, and the doctor hadn't written the prescription for it. So if Care Navigators hadn't been there, that person would have gone home without any pain medication for more than 24 hours. And obviously it was a situation where they needed that medication. So that's one of the ways that Care Navigators can help.
That's a testimonial, right?
I know.
It is a
Thank
testimonial.
you.
And we can all give one.
Yeah. So Tell us about a case where you've made an impact for the client emotionally, financially, and medically.
Sure. So there was a particular family, a daughter that was contacting me probably every couple of months. And she would call, and a lot of times we're working with people that are overwhelmed and they have a hard time processing and hearing information and really engaging in service because they're the daughter and they want to do the right thing for their loved one. So I never was engaged in service because she'd call every couple months that her mom had been bouncing in and out of the nursing home and the hospital and she was at her wit's end. And she'd be in her car crying all the time. I said, I can help you, but I have to come in. I have to do an assessment. I have to see what's going on medically, financially, legally, cognitively. What's the supports at home? You know, who's going to support her at home? But in this case, it was more medical. So I went to the nursing home and saw her mom, and she was in dire straits. Like, I knew by looking at her as a nurse that she didn't have much time left.
Wow.
So she had no motivation. She was no longer walking because she had been there at the rehab facility, which turned a nursing home for probably off and on. This went on for 2 years. And but I had started hearing from her, I think like a year previous to that. So we ended up helping her get her heart failure managed. She was gaining weight rapidly. Nobody was managing the heart failure. We ended up getting therapy started for her again, which you can do under Medicare B. We ended up getting her back and forth to the cardiologist's office, coordinating all that care, bringing the records in to find out could she go in for valve surgery. And in the end, we got her home for Thanksgiving, and she's been home. It's been a year now.
Wow.
See, because of your advocacy, okay, and this is why we're so excited to have you on the show. The outcome, if you weren't involved, could have been, probably would have been completely different.
Yeah, she would have passed away for sure. And financially, she was spending $300 and some a day at privately at a nursing home, which happens after you run out of your Medicare days and you don't qualify any longer. So obviously it saved them a lot of money. And they were able to go home without caregivers in place with the family caregivers because she was able to get back to, ambulating effectively and taking care of some of her stuff. She did have a caregiver. We did bring in a service for a couple hours a day, for medication management and that.
Which is great. And that's what it's all about. Explain how care management complements clients that may already have a caregiver company like right at home in their house.
Yeah, I love talking about this because we do very different sets of activities for the client. So as a care manager, you're coordinating their care, you're setting up the medications where the caregiver is going to give the medications on a daily basis. We're educating the caregivers as nurses and social workers to explain what the meds are. And if we have to make changes in the medications, we can contact the doctor. If we see the client's getting dizzy, maybe their blood pressure is low, we're checking vitals, we need to make medication adjustments. We're not driving the clients like the caregiver to the appointment. So the caregiver company like yourself would drive the client there, but we would be there to advocate for the patient because you get about 5 minutes to speak with the doctor when you're in the office. So we can tell them what changes have taken place and what's going on medically. And maybe we need new orders. Maybe we need to get skilled home care involved for physical therapy. So we'll obtain orders like that. And then we can do the bill pay, and the caregiver company can help us sort the mail. And obviously the caregivers that are in the house, like your company, would be the ones doing all the day-to-day, all the important functions like cooking and cleaning and bathing while we're coming in for the nursing and social work assessment. And a lot of times with our clients that are at home, if they're not able to get out as much, then we're providing those counseling services for them.
We have talked to families sometimes and just people just call up for information, and do you think sometimes we think about independent living, assisted living, skilled nursing, hospitals, home care, we think about it with maybe an old set of eyes, and that's not really the way the real landscape looks. As far as, are people sicker in each of the settings than perhaps they were prior to our Medicare changes and whatnot, or is that just anecdotally pick that up?
Absolutely. Interesting, because we just did a presentation in St. Charles, and it was talking about the different levels of care, and people don't realize it. There's independent, assisted, memory care, locked memory care, supportive living, nursing home, and then rehab services from a hospital. So you are seeing patients that need different types of care and different types of service, and they need a particular assessment to see what level of care is appropriate for them. We are seeing out there, just in general in the healthcare landscape, people are in the wrong setting. And financially, they're in the wrong setting, because we have to look at how much funds does this person have, how long are they going to live, what is their prognosis, and which level of care should they be in. And they're probably going to need the highest level of care at some point. So we may have to start thinking about nursing home and Medicaid placement. So that's really important. There are people that are definitely in not the right setting, or they don't understand all the different levels and what might be most appropriate.
What you were saying about Medicare or Medicaid setting, there's a waiting list for that. I mean, like, you can't just call up and say, I need to send this person tomorrow. So there has to be some advanced planning with that.
Absolutely. And this is what happens a lot, is people will go in, and there's nothing wrong with going into an assisted living or assisted memory care, but mom might have 10 or 15 more years to live. And they did not know. And I'm sure most of the communities out there do tell people that, this is private pay, but a lot of people too are out there with denial. The daughters don't want to think 10 or 15 years out. So they just keep thinking, okay, mom's doing fine, she's at assisted living. A lot of people, no offense, they don't want to think about going to a nursing home, that traditional looking nursing home. And so they're not planning for it correctly. And that is something that we can assist with for sure, because we look at the finances to see what do they need and how long are they going to live, and what's the next steps. So then you are looking for a bed, that's what we call it, at a nursing home. That's how healthcare clinicians, all of us, talk out there. And it's always changing. And those beds are getting more and more limited because of what's going on with our state and with funding.
But sometimes just finding a bed in the hospital is a challenge. I had a client last week, 16 hours in the emergency room waiting for a bed to open up at Lutheran General.
Yeah.
And so a hospital that size is still short on beds. And I know that they have certain floors and certain beds for certain conditions, so they kind of hold those things off, and so not everybody can go to like an open bed in the whole hospital. I understand that.
Right.
So can you tell how the care managers are a key part in planning with the financial advisor and attorney? I know that you just kind of mentioned that, because knowing what the prognosis is and the length of time, but how does the financial planner get in touch with you, or like when should they be contacting you?
Yeah, a lot of times we get contacted, probably like yourselves, at the most dire straight crisis time, right?
Exactly. The last minute, when it's an emergency situation.
Right.
Is that a good time?
No, absolutely not. Because now, as a daughter or son, or a husband or wife, as the caregiver, you're overwhelmed and you're not making rational decisions. Sometimes you're not listening, you can't hear, and you are going to end up spending like 10 times more money because you didn't plan effectively. So how we plan after someone gets their estate planning done there with an elder care attorney is they've got their estate planning, right? So they've got their will, and they've got their trust, and they've got their powers of attorney. We're going to do the planning on the POLST, which is the practitioner order for life-sustaining treatment. We want to make sure we document their end-of-life wishes. All of us at this table at some point are going to have that happen, right? We're going to have somebody making a decision. Wouldn't you want to document your own decisions on paper? So not just that, but also for the levels of care and financially, what funds do you have? Can you stay home with a caregiver? Which that's always my hope, is people can stay in their home. You get one-on-one care with the caregiver and one-on-one care with your private care manager, who's a nurse or social worker, who's looking out for all of your needs. And in a community is fine, but there's lots of people taking care of you, and there's lots of hands and lots of like information that might not be so detailed, like we were talking about with, I think it was Jeanette, your client that you were talking about. It's so specific. And then also we're looking, so not just financially, but we're looking medically. A lot of times we go in and we find that somebody is on the wrong medications or has been diagnosed incorrectly. Thinking about one client right now, she was diagnosed with anxiety, but they weren't treating her anxiety correctly. So she was having a lot of stomach pain. So it was a lot of stomach acid. We ended up getting her, so she was in and out of the ER all the time, the emergency room prior to that. So you're planning for everything, and also the safety in the house. Like what kind of equipment do we need?
Mhm.
Do we need to make home modifications? So all those
Mhm.
things need to be thought about. It's not, a lot of people think what your company does and what our company does can
Mhm.
be done in 5 minutes, and it takes some time and planning. But half the time we
Mhm.
are doing this right at the last minute, after hours.
Mhm.
Yeah,
After
spending
hours
hours.
in an emergency situation. And again, that's not the right time to do that.
Right.
And you were
Um,
mentioned about the counseling. So does an assessment need to happen for your counselors to come in and talk to somebody?
So for the counseling, and this is interesting for counseling, it's something that our older adults aren't really accustomed to, the thought of counseling. I think everyone could benefit.
Amen. And everybody give me an amen.
Amen. Indeed.
We all go through life challenges, and somebody who's a social worker who can sit down with you and reframe that information and help you process what's going on.
Mhm.
So all of us have probably been a caregiver in this room for our families. That's overwhelming. Having kids, having challenges with your teenagers, financial, etc. So the counseling for the assessment is a separate assessment. It's geared towards counseling, which is all covered under insurance, and we're under every insurance panel pretty much. So the only thing that's not paid for is the copay. You have a copay on your insurance,
Mhm.
and your deductible.
Mhm.
So I think seniors can benefit from it and caregivers,
Mhm.
because they're overwhelmed.
So
Yeah.
Medicare pays for this counseling.
Yes, they do.
Okay, so except for maybe the deductible or the copay.
Correct.
Okay, very good. And that's also, and I think our audience needs to hear this, that's also for the families.
Yes, yeah, for the caregiver, especially if you're a daughter or son and you're juggling your workload plus your family member plus your own kids, it's good to have somebody to talk to. And we can do that in person, or even better yet, for all of us that are really busy, via video. So you can have a social worker see you at your lunch hour, and just you have time to talk about your needs and what you're dealing with, and kind of understand that it's okay to talk about these things and to be frustrated. And sometimes, right, we deal with caregiver burnout. Sometimes these daughters or sons are angry and they feel guilty about that.
Absolutely.
Oh, for sure.
And I think that's in most cases. People are frustrated because they have their lives to live and they have this additional responsibility that we'll all have one day. So how do we deal with this? And so Care Navigators, has the counseling available for this. So please write down their number as we give it out.
How about, could you dig a little deeper into the healthcare advocacy services in settings like hospitals, rehabs, assisted livings? How does that work?
Sure. So every situation's very different. We've been called in when somebody is really not doing well in a hospital and they're thinking about doing palliative care or hospice. They're in an ICU setting. So we're going in to make sure that the right physicians are on board. So the right consults, the right medications are on board. They're getting the person up to ambulate. So even in a chair, you can lose up to 10% muscle mass a day laying in a bed. And a lot of times people, if they can't walk, they're not eating well, they're depressed, they're not motivated, etc. So we're looking at that too. We're starting to look at planning for going home. And one of the biggest things that we're going to do no matter what is look at their level of care in a hospital, which is either observation, outpatient, or inpatient under Medicare. So with Medicare, you need 3 inpatient midnights in order to go to rehab for it to be covered under Medicare. So we're looking at that also. So can we challenge level of care to get them to inpatient level? We're also looking at what supports they have at home. And my goal is always to get somebody home with a caregiver like your company. So we're trying to see, can we get them instead of going to a rehab, hopefully to the house, if they can afford, services.
Mhm.
So it just depends on the situation of what we're seeing at the hospital. So many times I've recommended like ear loss mattress for the patient that's bed bound on a ventilator, which will prevent from a bed sore. Looking at what they're, eating, is the diabetes managed? A lot of times they're not looking at the big picture. They're only looking at the one diagnosis they came in for. And the thing that I always see overlooked is heart failure. And that is the biggest readmission diagnosis for the hospital. So I want to make sure that there's a cardiologist on board to manage that heart failure. So I hope that answers that.
And it does, but let's cover congestive heart failure real quickly, because that's actually how my dad passed away.
Oh,
And he was under a nurse's care at the time which was very surprising. What is the number one symptom for congestive heart failure?
Shortness of breath and gaining weight. So if you have somebody who has that, you should be weighing them every day to make sure they're not gaining over 2 pounds. And when they do, that's when we put a call into the physician to see, do we have to change up the diuretic? And that's something we do pretty often. And a lot of times it is overlooked.
Very overlooked.
Because they're looking at whatever brought the patient into the hospital, but we have to look at the whole picture because our bodies are like a car. They all work and operate. It operates together. So we have to look at everything.
At our event, Caring for the Caregiver, in fact, we haven't had a chance to talk, but now is a good time.
Yeah.
Explain how you can assist with long-term care insurance.
Oh, that's one of my favorite things to do to help people financially. So if a client has a long-term care insurance policy, especially the older policies, those are outstanding, a lot of them. They are very different. It's very policy specific, but we can open that and hopefully try to get around the elimination period. What I mean by that is there's usually a 90-day elimination period that you have to pay into privately in order to access the benefits. Not only that, but also it requires an assessment, and our older adults always tell the person that comes in for the assessment they're doing fine. So if we can open this claim under the long-term care insurance, we can get around the elimination period and we don't have to pay in the 90 days. I have saved people up to $40,000.
It's amazing. So, we feel we're educators. I had no idea. And I know a lot of our clients, in fact, we have clients that are very good planners and have long-term care insurance, and they're frustrated when they call us because they have this elimination period. So now I know who to call.
Yeah, and we can try to do that. And we're covered under that for nursing and care management. And also, obviously, caregivers are covered under that too. Like
And
your
so
company.
the long-term care insurance will cover care management.
Yeah, care management or nursing.
Okay.
Yeah. There have been a couple of policies I've run across that will only, one particularly recently in Huntley, they would only cover a community, period. So assisted living, nursing home type of care, they would not cover caregivers, which is unusual.
That
Or
is
care
very
managers.
unusual. Yeah, that is very unusual. Because the whole industry, from hospital to rehab, is going so fast and changing. The hospitals want to get you out. Rehab is going to be limited to a number of days, and then they want to get you home.
Correct. Yep. And another thing is people don't realize the long-term care insurance policies also have durable medical equipment benefits and home modification benefits and care plan benefits so that we can write up a plan of care for the patient. But it's very specific, every policy. And then there's sometimes caregiver training benefits. I don't know if you know about that.
No.
So sometimes up to about $1,800 for someone to come in like ourselves to train the caregiver on some of the medical stuff like turning, repositioning,
Hoyer lifts?
Yeah. Yep. Hoyer
Wow.
lift. Yeah.
And so I need to back up for a second.
Sure.
We were talking about the adult children of the people needing counseling. And we were talking about the individuals, the Medicare would pay for that counseling. But would Medicare pay for the counseling for the adult children?
Well, the adult children would have their own insurance policy. So say they have Blue Cross Blue Shield, we would go under whatever employer-specific insurance policy that they have. So we would just, drive that benefit through the person that is asking for the counseling. So whether it's Aetna, Cigna, what else is out there? Yeah.
And so if they have counseling, then is it considered psychiatric?
I don't know what the code is off the top of my head. I'm a nurse. That's my background.
Yeah.
But we do have coding under each of the, there's probably like 10 or 15 codes that are usually used for what you're doing for the psychotherapy for the client.
Yeah, because I just feel like the insurance companies kind of penalize the person that's getting the counseling if it's psychiatric because they either won't cover them or they raise their premium as a result of that. So I'm wondering if that's what's causing like society to back away from getting that counseling.
I'm not sure if it's that because there's been a lot of parameters put into place around insurance and it is private. I mean, obviously the insurance company knows that you're getting counseling, but it is confidential and HIPAA confidential. And if the employer is paying for the benefits, then I don't always see the premiums increase. But one of the things with mental illness in general is there's a stigma that people think counseling is something that you would do only for someone who has severe anxiety or schizophrenia. It's really for anyone who's going through any kind of adjustment in their life. So there's a stigma. People don't want to say that they're going to counseling. I would say the younger adults that I meet, they're very open about that. I think generations of anyone, including myself in my 40s, we are more private about things, and we feel like we should be able to handle that and deal with it ourselves. But we all need support at some point, and that's really what it is.
Yeah, it's just real support.
Yeah.
So, just also want to kind of go a little deeper in what are the emotional benefits for spouses and adult children that care managers can provide that perhaps they're burned out and they could benefit?
Well, and I'm smiling about that one. I can't tell you how many times I've had people in my arms crying, adult children and spouses. One of our clients that we were moving over to a rehab facility, the son had never stepped foot into a nursing home and was petrified. And I basically, without, showing that I was kind of holding on to his back the whole time, like while we were going through, and just kind of like patting him like, okay, it's okay, without saying that out loud. So the emotional benefits are huge. People are losing, up to $300,000 in a lifetime of income by taking care of their loved one. And when someone steps in and says, I don't need to be here all day to look for, somebody to come in and tell me what's going on. I'll read the chart and figure out what's happening, and we will plan and do what's right for your mom or dad or your spouse. They're just relieved because the burden has been lifted from them.
Absolutely.
So there's a huge emotional benefit. I'd say almost every case I've had people that are just, in tears, that they're just so happy someone is taking their hand and their loved one's hand and saving their life if possible.
Well, and the reality is that you're able to provide care and information advocacy that they don't have the skills to provide.
Yeah, absolutely. And that happens a lot when I go into like a rehab center and you walk into a care conference and there's 10 people sitting around to talk about your loved one. And they feel like that whatever they say, it's a rule, that this is what has to be done. It's a guideline, it's a template, it's information. And we're humans, so we're not like machines where this works for this person, this doesn't work for this one. And so they do need that guidance because they're not medical. They don't speak the language. We've had multiple people that are CEOs and, high level people, and they do advocate well, but they're not nurses. They're not social workers, and they don't know the system.
Jean, we can spend another half hour on this, but
But the show's only half hour.
the show's always a half hour. Please share your contact information real quickly for us.
Sure. So if you would like to give us a call for any help, we're at 847-250-1829. You can also look up our website at www.care-navigators.com. And again, our phone number, 847-250-1829.
Jean, it's been such a great pleasure having you back again, and thank you for what you do for our seniors and their families.
Thank you.
Which part are we doing?
Okay, so our show is brought to you by Right at Home, the 4 pillars of right care from Right at Home. Me and your loved one is being cared for the right people, doing the right things, the right ways, for the right reasons. Make the right choice today. Call Right at Home at 877-ELDER99, 877-353-3799. And if don't touch that dial, stay tuned for the Radio Shopping Show right here on WRMN AM 1410. And guess what? FM 96.7. See you next week at 9:30 on Silver Solutions Radio.